right here. Answer this.
The nurse is talking with the client who has a positive laboratory test result for human immunodeficiency virus HIV. So the nurse is talking to a client who is HIV positive. Which of the following statement by the client would require follow-up? So these are the 4 things that the client mentioned them. So we need one that the nurse needs to act on it. So 1, I try to eat a well-balanced diet. That's good. We need a balanced diet almost for everything. So I'll cancel that, eliminate that. I avoid crowds when I go outside the house. Why should she avoid crowds? Because all I know that this disease is transmitted through blood or so I'll put that a question mark. I'm taking a vitamin C tablet daily to help prevent infection, which is good, taking vitamin C. So that's a good point. I take HSS every day to help improve my immune system. Yeah, that's fine. So I will question 2, avoid crowds when I go outside the house. So I'll choose 2.
All right. So your answer to this question is 2.
Yeah.
All right. Let's break the question together. Now, the nurse is talking just like the other question that was talking, right? Now we expect
Mhm.
statement. So that's the reason why when you read your examiner question, it's always going to have the keyword statement. Now, the nurse is talking with a client who has what? Positive laboratory test results for HIV. So the patient have what? HIV. Now, which of the following statement would require follow-up? So we are looking for statement that will require follow-up related to a client who have what? Positive what? HIV test result. Now, this is statement 1, statement 2, statement 3, statement 4. Now, since we have all this statement, we need to now find out which require follow-up. Now you need to understand, same way we understood that particular question, a patient that is what? Receiving insulin, same way we want to understand what HIV is. HIV is what? A patient that what? We have immune problem, right? Their immunity is not going to be strong. And that is even the main reason why the NCLEX is saying they should eat well-balanced diet. For a patient that is having bad immune, definitely this is going to be correct for them. They don't require what follow-up. Right. For a patient that's having bad immune, definitely we want them to avoid crowd. Because if a patient is having immune problem, definitely we want them to avoid crowd. Because a patient that is having immune problem, they are exposed to infection. They are at risk for infection.
Yeah.
So if they go to a
Yeah.
particular crowd that will cause them to have infection, it will be a problem. Remember, the immune system is not working. Right. So these don't require what? Follow-up. These don't require follow-up. These don't require follow-up. Now look at number 3. It said, I am taking vitamin C tablet daily to help prevent infection. Yes, vitamin C help the immune system, right, to fight infection. So these as well too don't require what? Follow-up. Right. Look at this one. This is talking about herbs, right? Right. Daily to improve immune system. Herbs are good, but not when you don't have a fighting system, when it's going to do the other way around to your body system. Right. So we don't really encourage herbs for patient that's having immune problem. Right. So that's the main reason why this is bad. Right. We don't encourage it. Right. Because most of the time, most herbs are not properly prepared in a certain way that it can kill any certain kind of what bacteria that might be in it or something like that. So if you are giving it thinking it's going to do something, but it's going to cause the opposite, we don't want to do that for patients that have immune system problem. So that's the main reason why this is going to be the red flag. For HIV or any immune problem, we don't want to expose them to herbs. We don't want to expose them to fresh fruit or fresh food. We want to expose them to washed fruit that you have washed, right? You
Um,
also want to expose them to very cooked vegetables. You want to expose them to very cooked food, not fresh food, fresh fruit, red flag, or herbs, red flag. So that's the reason why this require what? Follow up. So the answer to this
follow.
question is 4. Is that clear enough?
Yeah. Yeah.
All right, great. So if you want to, what you are taking from this question is you want to understand that It's not that you only want to understand HIV. You want to understand the fact that these patients fall under the category of what? A patient that their immune system is
Immune
already
system.
destroyed. Their
Mhm.
immune system is destroyed. So their new way of living right now must be related to a patient trying to what? Avoid infection. Everything that they are doing must be related to them protecting themselves from infection. So eating a well-balanced diet will help them out, at least to still help the body function properly, right? Avoiding crowd will help them prevent infection, right? Or
So
avoiding,
this, sorry, so this also falls under the category of those people with chemotherapy,
yeah,
transplant. So okay.
exactly, definitely. Yeah, found that as well to anything related to immune. That's the reason why when I teach students to read, I don't teach students. You see how I'm breaking it down? I'm not saying,
Yeah.
oh, you need to go and read about transplant, you need to go and read about chemotherapy, you need to go and read about neutropenic, because neutropenic is also part. But
Mhm.
guess what? If you can just understand the one key thing, this is what I always tell students, everything in nursing is tied to one key thing. There might be different problem, but they have the same problem. It's just like we have different respiratory condition, but they only affect one body system, which is the respiratory system. So the same intervention we are trying to do for asthma is the same one we might likely do for COPD, is the same one we might likely do for pneumonia. There might be slight difference, but at the end of the day, all the intervention are also related to the respiratory. So if you can learn every intervention related to the respiratory, if you see asthma, you'll be able to answer it. If you see COPD, you'll be able to answer it. If you see pneumonia, you'll be able to answer it. Same with immune disorder, right? If you learn intervention related to the immune disorder, if you see HIV, you'll be able to answer it. If you see transplant, you'll be able to answer it. If you see chemotherapy, you'll be able to answer it. If you see neutropenic, you'll be able to answer it. Because they are related problem, just different name, but they still have same similar intervention. So why would students now start to be reading thousands of things? The only thing you need to know about all this problem is to understand that HIV is a condition that destroy what? The immune system. Transplant, they end up becoming immunocompromised because of the medication that they are using to suppress the immune system. Chemotherapy as well too, because of the medication, right? Neutropenic,
Mm.
they end up what having what low WBC. So this is what you need to know. So when you know something like this, now you have an idea of what is going on, you have an idea what is affecting, and you know how to act as a nurse. This is how you read, and you pass the NCLEX exam in minimum question. This is how you read in a way we call what the smartest way to study, right? A way you don't need to
Mhm.
read or study hard, right? Are you enjoying the process?
Yes.
Okay, I'm glad to hear
Yeah.
that.